Children across the world are going back to school, but what lessons have been learned after the disruption caused by COVID in the classroom? And in what areas must we all try harder? More than 1 billion students were affected by school closures last year. Now, children are returning to the classroom, but with many unvaccinated and not wearing masks, will we see another big increase in infections? And do the benefits of in-person teaching outweigh the risks of virus transmission? Hello there, welcome to Roundtable. The British government has just approved vaccinations for 12 to 15-year-olds across England. But will this be enough to prevent a surge of new cases as schools reopen? Are enough precautions being taken? COVID-19 has created the largest disruption of education systems in history. It's affected nearly 1.6 billion students across the world. Less well-off countries have been the worst hit. As schools across the globe start to open again after the holidays, there are concerns over the vulnerability of unvaccinated children, and pressure's been mounting to get more children jabbed. EU politicians are lobbying to get younger age groups immunised to prevent a new series of school closures this winter, with some countries approving jabs for 12 to 15-year-olds. Health experts have condemned the lack of protection in schools and fear there'll be another surge in COVID-19 cases. In an open letter in the British Medical Journal, scientists have warned there's been no plan for robust mitigation measures in schools to reduce the risk for children from infection and the consequences thereof, including long COVID, hospitalisations, staff safety and educational disruption. So how prepared are schools and what precautions are needed now that they're back? Well, joining us on Roundtable today, in Exeter here in the UK, we have Dr. David Strain, a senior clinical lecturer at the University of Exeter Medical School. In Wiltshire, we have Helen Ross, a special needs secondary teacher. And in Tel Aviv, Georgia, we have Ghassan Khalil, a UNICEF representative for Georgia. Good to have all of you with us. Helen, I'm going to start with you because as a teacher, there's going to be a lot of attention on you and your colleagues over whether classroom teaching can be conducted safely. Do you feel confident about going back into the classroom?
I mean, I suppose how long is a piece of string? I think I'm as confident as I can be. I mean, the school I work at, our senior management have done everything. They are so thorough. They are so, I'm really forthcoming with the work and the thought processes they've been through. I'm double vaxxed, and actually Wiltshire Local Authority was very, very quick to make sure that key workers and people who were sort of at the coalface were double vaxxed. So I think, given the background sort of ambient risk, I think I'm as confident as I can be.
What are they doing in your school? Are there things like, are we still going with bubbles, daily lateral flow tests? What kind of precautions?
Not daily, no. So our kids are in line with government guidelines. We've done 2 lateral flow tests between starting school and now. And the kids, they've all got a lateral flow test to do once on a Sunday night, ready for Monday morning, and then on a Wednesday night, ready for Thursday morning. So they're doing the 2 lateral flow tests. We are, as best we can, distancing. I mean, when you've got 30 children in a relatively small space, it's a bit tricky. Some students are still wearing masks, some aren't. Just as best we can, we're ventilating. So when you've got 30 children in a room, plus a teacher, maybe plus a TA, you can't necessarily be 2 meters or 1 meter plus from people, but we're doing the best we can. And I think it's a very fine act, and I don't envy people in power at the moment having to make the choice between the definite risk and the definite complete disruption to young people's education, because not everyone's got access to IT still. So if you go to remote learning, not everybody can access it, and some kids sink because of just the way that they engage with education, versus the risk that they may get a particularly nasty dose of experience of COVID. So it's not an easy risk
it's
factor to
obviously
engage with.
a balance that everybody
Yeah,
is trying to
exactly.
balance out. Parents, teachers, government. Yeah, absolutely. David, we know that the government here in the UK, well, in England, has just approved vaccinations for 12 to 15-year-olds. Some countries already doing it: France, Germany, Italy. That's a balance as well, vaccinating children, the health risks versus the benefits. What are the benefits of vaccinating 12 to 15-year-olds?
Thanks. It's a really important question that's caused lots of controversy recently. The benefits of vaccinating the 12 to 15-year-olds from severe COVID is actually only very slight, because we know we have only seen very, very few cases of severe COVID in those children. However, the real benefit is that they're not going to be missing as much school. The numbers of people missing school in the last couple of weeks before summer holidays was about 14% of all children in England. If we can go to a vaccinated state where we don't see the disease spreading around the classrooms, then those children will be able to stay in class and therefore have a better educational experience. The other advantage for them is the risk of long COVID. We're seeing different reports. The most conservative estimate says it's about 1 in 50 children who get COVID will end up with long symptoms. The most recent report that came from Sir Terence Stevenson said it was about 1 in 7. That means if children in a classroom of, say, 28 kids, if they all got COVID, none of them would get really unwell, but we could be left with 3 or 4 unable to participate in education for the next 2 to 3 months afterwards. And that's where the real advantage of vaccination is going to have for the kids themselves. There's also a risk of onward spread. The risk that if you're vaccinated, your chance of spreading it further is lower, and therefore that then becomes an important consideration from a parent and grandparents. But again, that's less of an impact on the schooling.
And that feeds into my next question, which is vaccinations for children. It's going to be a voluntary thing, up to parents to decide. But is that one of the precautions that can be taken when schools reopen to try and stop a surge in infections? Or do you think there's going to be a surge in infections regardless now that schools have reopened?
We are going to see a surge of infection. It takes several weeks for a vaccination program to actually reduce the spread that's going on there. So the recent change, the announcement that was made yesterday, is really going to have an impact from end of October, beginning of November onwards. And we've got this time frame in the middle that we need to try and get the balance right. And keep these extra measures in place, such as the masks in communal areas and the ventilation that's going on at the moment, in order to get the pits up until that November time point.
Great. So, Ghassan, let me come to you, because I know that UNICEF is calling for all schools to reopen across the world. Why is that? What are the concerns about keeping them closed?
Yeah, I mean, UNICEF has been calling since last year for schools to reopen, but safely. And what we have been saying in UNICEF, and WHO joined us also recently in a joint global statement, is that schools should be the first to reopen and the last to close. And here in Georgia, our discourse, our approach with the government is that why should we have preconditions and prerequisites on the educational sector and not on other sectors? For instance, when children are going to theaters, movies, restaurants, malls, etc., why can't they go to school? And just last week we had an event also with the support of ambassadors of Norway, Estonia, and Lithuania. And the ambassadors of Norway and Estonia revealed also studies in their countries where the negative effects of online learning, online education has been very, very, very clear. And it leaves for years and years also negative effect. But at the same time, like in Estonia, they said whatever happens, schools will remain open. Schools have to adapt to the situation to remain open. But let me come back to Georgia, where 50,400 children do not have any access to internet. So what we are saying in UNICEF, someone needs to tell us how these 50,400 children will get their online education.
So even if countries like Norway are seeing schools as increasing the spread of COVID, you think they should still reopen?
No, let me talk about Georgia, since I work for Georgia. And in Georgia, let me say that we have suggested to the government a differentiated approach. The government wants to open schools only when positivity rate of COVID-19 infection goes below 4%. Very good. This is, a decision to be made by the government. This is a sovereign decision. What we are saying, the last remote village in Georgia should not wait until the capital or any other city gets the less than 4% positivity rate. So there are many areas, not only villages and towns, many areas in Georgia where the positivity rate is much less than 4%. So why to have a blanket decision and close all schools across the country when these children, who many of them do not have access to internet, can receive that in-person education? In addition to that, we are constructive, supportive, and we signed a 3-month intensive plan with the Ministry of Education to vaccinate teachers. After 7-8 weeks, we have seen an increase in the rate of vaccination of teachers nationwide from 7% to 46%. And it is ongoing, and we have a 3-month intensive plan. So also the vaccination of teachers will help a safe reopening of schools, along with a differentiated approach as well.
Okay, well, let's talk about the harm done by closing schools, because I know this is something that you're very aware of, Helen. You mentioned it before, a lot of children still don't have access to online learning. How damaging has it been to children's education to have all those school closures?
Interestingly, I'm going to toot my own horn for a minute. When I'm not a school teacher, the other 9 days a week, I do an awful lot of independent research, and my field of research is special educational needs. And I ran a project last summer that I'm winding up, and it was around the effects of COVID and remote learning on young people who had special educational needs. I focus mainly on specific learning difficulties, so stuff like dyslexia, dyscalculia, and those kind of things, and neurodiversities, but also on young people with kind of autistic spectrum and ADHD. And particularly for people who struggle with their literacy, online learning can be brilliant, but the way it has been implemented, even if you've got access to a computer, if everything is presented to you in written form, so a lot of schools use Microsoft Teams, Google Classrooms, other software packages are available. If you're just thrown a load of words, you're not going to necessarily progress. So even if you have tech, it's not necessarily great. So that's one side of remote learning. And I call it remote learning because it's not necessarily online learning. Like Khalil was saying, there are huge swathes of young people who don't have access to a computer. And if the expectation, and it has been in political discourse since, April last year, around Easter time, that things would just flip online. If you haven't got a computer, or if you've got one mobile phone to 3 kids who are all in different school years, and your signal's a bit rubbish, which Wiltshire, the signal's a bit rubbish, what are you supposed to do? And I don't know the demographics, I don't know the logistics of Georgia, but I imagine it's probably a little bit more tricky than the wilds of Wiltshire to get phone signal or decent signal in before you then think about the physical equipment to access remote learning. So if you haven't got it, but the expectation, the discourse is that, just flip it online. It's not a flippant thing. It's not a thing.
It also depends on how many kids you've got at the end of your Zoom call. My daughter was lucky. There was only her and another one in a classroom, but some people had 30 kids. I mean, that must be a nightmare trying to do a Zoom call with 30 kids. So do you think the problem then is that different areas are going to have coped differently with lockdown, right?
Absolutely. When you look at, so I read a study as part of my lit review for the thing I've written up. It's in review at the moment. But an area of the United States that was a very rural area, they had a very kind of bottom-up way where the school district listened to what parents could do. So like what have parents got? What's at home? So the schools could then adapt to that. Whereas other areas have just gone, the whole area, the whole school district is going to flip online, parents deal with it. So it really depends, so much depends on kind of the philosophy, the expectations behind policy frameworks before you even get to the
and I mean, let's not even get into if the mums and dads are working and you know don't have time to sit there with their kids. David,
I struggle to find polite words.
Yeah. I tell you what, after trying homeschooling, I think teachers are terribly underpaid, and you should all have, you know, a £2,000 pay rise immediately, 2,000% pay rise immediately. David, it also affects older students. My daughter's starting university. One of the questions lots of students are asking is how many of their lectures are going to be online. Do you think there is a generation of young people, you know, right across the world who now have gaps in their education?
Absolutely. And there's also bigger gaps. Actually, my eldest son, I've just dropped him off at university only yesterday. And one of the things that he's already facing is that despite physically being on site, about half of his sessions will still be in this online format. And there is more to education than just getting the information in. There's a lot more to going to university than getting your degree. It's also that personal development. There's that growth. There's the interaction with people that you wouldn't otherwise meet. And that's something that I'm really worried that an entire generation will be falling back on. We've got children who are, even when they've got full-time parents providing the additional education, and like you, I now think all teachers deserve a massive pay rise. But even when you've got parents at home that can do nothing but devote their life to doing that, the children are still missing out on other chunks of the education that just being able to do the arithmetic and do the reading and writing cannot possibly catch up for. And this is something that I do worry about going forward.
Yeah, Ghassan, this is one of the things you were saying, that it's not just about the learning, it's the impact on your social skills, it's the impact on your mental well-being.
Absolutely, absolutely. I mean, we have to think of the mental health of children. I mean, sitting behind the screen, and this is not the social interaction they need. And the social experience, the socialization process that children get in school by interacting with their peers, by interacting with their teachers, with the school administration. This is a huge and very important experience for their life. And then let me say also, it has been proven at a global level that schools are not a key drive for disease transmission. This has been proven. So what are we doing when we close down schools? We have to think of all these, in addition to children regressing academically, and also those children who have some learning difficulties, what happens to them? And all the children then who are from ethnic minorities or living in remote areas, again, there should be a differentiated approach where we call for safe reopening of schools. And UNICEF in Georgia is supporting the government in making sure that there are appropriate hygiene practices, physical distancing, and also using masks when needed, and linking it to the infection rates in different areas of Georgia. We believe this should be the approach everywhere. And also governments have to remember that schools should be the first to reopen and the last to close.
So what kind of precautions are schools in Georgia taking to make it safe for kids to go back to school then, Ghassan?
Exactly what I just mentioned. They are applying physical distancing. They have.
Are children going to be vaccinated?
And let me say that first, we are supporting the vaccination of teachers. Okay, the vaccination is always voluntary, of course, but we are promoting vaccinations. UNICEF team is going from one region to another every week to promote vaccinations with prominent health experts of Georgia who are influential in the society.
What about vaccinating children, though, Ghassan?
Yeah, vaccinating children, the government in Georgia is waiting for a recommendation from WHO to start vaccinating between 12 to 16. So as for now, the government wants to wait for the WHO recommendation.
Right. I want to touch on something that you mentioned there, Ghassan. You said that there was that research showed that schools were not drivers of COVID-19. And in fact, Sweden is one of the countries in Europe whose lower secondary schools remained open throughout the pandemic. And researchers found this. They found there was a small increase in infections among parents. Among teachers, the infection rate doubled and infections spilled over to their partners. But it suggests that keeping lower secondary schools open had a minor impact on the overall spread of SARS-CoV-2 in society. David, as the clinical expert, this is quite interesting, isn't it? So that study found that keeping schools open certainly had an impact on teachers, not so much on the families of students. Is that what you'd expect?
So for the first wave, so when that data was done, it was predominantly the original wild-type variant that we were looking at. That I would agree entirely that the original wild-type variants of COVID produced a small number of viral particles in children. They were not as transmissible, and therefore your risk of catching it was nowhere near as great. Unfortunately, with the Delta variant, this does appear to have changed. We are seeing, since schools have returned with the Delta variant now being dominant, we're seeing a massive change. So, for example, in the UK, in Scotland, schools went back 3 weeks ago, and the total number of cases in Scotland have almost quadrupled in that time frame. It's gone from around 1 in 90 people having COVID down to 1 in 45 total population actually having COVID at any one time. A similar thing is seen in Germany, where when the schools went back over the subsequent 10 days, the number of COVID cases rose by almost twofold. Now, these are all the cases that are occurring, and we do have to look at this in context of the virus that's there at the moment. Remember, the Delta variant produces nearly 1,000 times more virus, and therefore children who previously couldn't infect parents, couldn't infect adults, are now putting their families at risk. And therefore, we need to be looking at wider measures as well as the vaccination. Now, don't get me wrong, I agree with absolutely everything Ghassan said about the importance of keeping schools open and getting them going. But it has to be schools opening safely with additional ventilation, with those masks in the communal spaces, and with the ability to maintain some sort of physical distancing in those classrooms. And
do you think that's happening? Do you think schools are prepared in the way that you've suggested, that they are taking the correct measures?
So our children have returned to school. They have returned wearing masks. The classrooms have got carbon dioxide monitors. Remember, it's impossible to measure the level of the virus in the air, but the virus comes out on our breath. We also breathe out carbon dioxide. And so if the carbon dioxide levels start to go off, that suggests that the viral load might be higher. And that's the point that the classrooms all open their windows. We all see a position where the schools can then take windows open even in the worst weather.
So, Ghassan, let me come back to you, because the Delta variant changed everything. Maybe schools weren't a driver for infections before, but as we've just heard from David, they can be now because Delta is so much more infectious. Does that change your opinion at all that schools should reopen?
Well, it does not change our opinion, because, I mean, since the beginning of this pandemic, we have been learning, and we have to continue learn, and who knows what comes up tomorrow. So the key to success in societies in general, not only in education, is the ability to adapt. the ability to adapt to changes and to face and overcome the challenges brought up by COVID-19 pandemic. And I mean, when schools are also closed, it does not affect only children, it affects also parents, because they will not be able to perform their jobs as well. And then it affects the whole society. So what are we doing here? So we have to really think in a holistic manner, and we have to promote and encourage vaccination, promote and encourage a stronger protection, prevention. This is what we have to do, rather than resorting to closing schools. I mean, closing schools will not solve the problem, but adapting to the realities, overcoming the challenges while keeping schools open. This is what we should do.
Go on, Helen.
I don't disagree. Like, I haven't read our school risk assessment. I'm not going to lie. It's huge, and I'm human. I'm human. But when the talk of kind of the CO2 monitors in England, I'm not sure for Scotland, but I know England it's been suggested that schools are going to get CO2 monitors for classrooms. And then, you know, like Steve was saying, we're going to open everything up. But our windows, if you're on the first floor, the windows don't open like full whack because safety, you know, kids.
So ventilation is an issue then?
Ventilation is an issue. And the classroom I teach in is quite a dinky little room. It's a 1950s school build. I think probably built for 20, 25 kids. I sometimes have 32 children in there.
There's a lot of agreement that everything possible has to be done to try and keep schools open as soon as possible with the right precautions in place. It's been great to speak with all of you. Thank you very much indeed for joining me. David Strain, Helen Ross and Ghassan Khalil, thank you. And don't forget, you can see more discussions and debate on our YouTube channel. Just search for TRT World Roundtable on YouTube. But for now, from me and all the team, bye-bye.